Let's face it, the world is becoming a digital playing field. Australia has been experiencing a dramatic demographic change, which prominently affects the health sector. The Australian Medical Journal 2010 concluded that there is a primary concern with the existing system. The interoperability of the current system makes it extremely time-consuming to share information between hospitals, pharmacies, and primary care physicians. Within this problem, there exists a unique opportunity to centralize medical information that is readily accessible whilst generating revenue. The digitalization of data is an effective way of preventing misdiagnosis that has clearly been a prominent concern among Australian health practices. We propose to innovate a centralized medical information hub that is readily accessible to all Australian health facilities, otherwise known as the Retrospective eHealth Initiative. The Retrospective eHealth Initiative, also known as REHI, is Deloitte's way of capitalizing on these trends in order to reap the reputational and monetary gains. So what can Australia get out of this initiative? This will offer improved patient experience and safety, seamless transfer of medical information, clinician-driven design, system-wide clinician support and adoption, competitive advantage in attracting targeted patients and quality care providers, lower administrative costs and reduced paperwork, accelerated CIS system design, build and integration, and lastly, issue-free processes and system implementation. But what does that mean for investors? The total benefit of eHealth records has been projected to $11.5 billion over 15 years for both government and private sector. This is a significant amount considering the current investment of $104.6 million per annum being made for the struggling PCE HR project in Australia. The return on this profile is further reflected by the performance of the American eHealth system, which demonstrates peak levels of growth during the latter stages of implementation. Even though the graph demonstrates initial, modest levels of return, it is also important to consider that during the fundamental stages of implementation, the project will be more financially assisted by the government promoting the new healthcare system. So, it is an inevitable fact that if this project is sustained, the rate of investment is expected to grow at an exponential rate. So what will Deloitte bring to the table? During the implementation phase, Deloitte will play a key role in consulting with the government with regards to the infrastructure, technology, and resources that are required. Although this is a temporary role, Deloitte will also behave as an integrator of data, which will generate consistent revenue from big data analytics after the implementation phase. Overall, because the system is digitally advanced, Deloitte will also have a stake in maintaining the system through its digital support channel. The momentum of this project will be enhanced by the rapid adaptation of wearable technologies, smartphones, cloud database, and biometrics. How will we integrate all of this? Picture the average man who has fallen ill. What options does he now have? Well, now every health facility in Australia will include biometric authentication to access Medicare. But wait, he has a smartphone, which he can now use to streamline the process using NFC. However, let's make it even more secure. After providing his biometric authentication, he will need to enter a unique PIN. In the doctor's office, he once again streamlines his smartphone and provides the fingerprint. The doctor tells him then to verify his identity and then enter the PIN. From this, the doctor can access a wealth of information about the patient. The doctor then updates his profile by entering the symptoms of this ambiguous condition during the consultation. She then utilizes the Retrospective eHealth Initiative database to find similar cases in order to assist in quick consultative diagnosis. She then notices his smartwatch data is linked to his EHR. Using this data, she notices some irregularities in his pulse and decides to refer him to a specialist to prevent a fatal misdiagnosis. The next day, he receives an appointment via his smartphone from the specialist regarding the consultation with the GP. Through the same process via the cloud database, that same information is now available to the specialist, preventing any miscommunications that can disrupt effective diagnosis. Digitize your health. Get ready for REHI.